And again, I'm Rain Brown, and I'm Program Manager with the Western Region Homeland Security Advisory Council here in Greenfield, Massachusetts. I hope you had the opportunity for a brief stretch and are refreshed for our next session. And for our first Skills and Drills workshop of the day, we are honored to welcome Jeremy Segall. Jeremy is the System Chief Wellness Officer at NYC Health and Hospitals, the largest public municipal healthcare delivery system in our nation. As System Chief Wellness Officer, he oversees the wellness from multiple angles, including enterprise wellness via staff wellness, response efforts, and patient wellness via engagement strategy. Today, Jeremy will present the topic of organizational well-being, enhancing internal and external resilience that supports a culture of workforce wellness. We're very happy to have Jeremy here with us today. So Jeremy, I'll hand it over to you.
Excellent. Good morning, everyone, and thank you so much for providing me this opportunity to share just a little bit about our approach to workforce well-being across NYC Health and Hospitals. Again, my name is Jeremy Segall. I am the Assistant Vice President in the Office of Quality and Safety at NYC Health and Hospitals. I've been with the system for over 12 years now. And my background is that I'm a licensed creative arts therapist that has worked in psychiatric inpatient, outpatient settings with a variety of different populations, found my way into quality improvement, and then have had the opportunity to be able to support our workforce, both frontline clinicians and non-clinicians across the care experience, employee engagement, and patient satisfaction portfolios, but also was able to become the inaugural System Chief Wellness Officer at the height of the pandemic, to which prior I was the emotional and psychological critical response lead as part of the support for our emergency management approach throughout all waves of the pandemic on here on out. So I am so excited to be here today, but I'd be remiss if I didn't say a hearty thank you to the Western Region Homeland Security Advisory Council. Truly appreciate you reaching out. It has been an incredible conference thus far, and we hope you're all enjoying yourself. So before we dig in a little bit today, I just do have to disclose that myself as the presenter, I have no relevant financial or non-financial relationships. Anything that I am presented upon, described, or reviewing or evaluating, I have no financial ties to. So just have to say that as a municipal healthcare worker. So today we're going to be focusing on just a few things, really looking at the crucial link between workforce well-being and the quality and safety of how we provide services to the communities that we serve, despite our modality, discipline, or service line. We're also going to be talking a little bit about framework today. The thing about workforce well-being is we do not have to reinvent the wheel, that there are a lot of models or frameworks out there that we can use to align with, to give us ideas and to grant us permission and allowances to really start wherever we can within well-being, whether it's at a facility, an entire system or enterprise, or even just within a small unit or team. And we're going to be talking a little bit about our approach to workforce well-being, which is called the Helping Healers Heal program, which at first was the Second Victim Response Initiative, which I'll touch on very shortly today, but really talk about how anyone, anywhere, has the opportunity and ability to really approach workforce well-being from a holistic standpoint, and that you can align your programming to your workforce needs. So just a little bit about NYC Health and Hospitals, and as Rain mentioned, we are the largest municipal public healthcare delivery system in the nation. We provide a lot of different services. We have 11 acute care hospitals, 5 post-acute long-term care facilities. We have over 57 clinics under one FQHC. We have at-home home health services serving the community, as well as we have correctional health services and our own comprehensive care management plan. So with that said, when we talk about the enterprise-wide strategy today, we want you to understand that you can start small, scale up, and spread. And that is exactly what we did as the largest system today. So anything that I'm sharing today can be modified, adapted. And toward the end of today's presentation, I will be welcoming questions if we have time, as well as my contact information is embedded. So feel free to reach out. We are an open book, everything, all of our resources, happy to share, as we are all part of the same mission to provide compassionate care to all caregivers as frontline workforce members. So part of what's on your screen toward the right side is our strategic pyramid at NYC Health and Hospitals. And while our mission is to help all community members live their healthiest life possible, we have decided to say that that can't just be about the patients or the communities that we serve, that we must provide compassionate care to our caregivers, whether they are frontline clinicians, whether they're frontline managers or supporters supporting those touching patients or by the bedside, but that all care that we are providing to the communities, we have to shine a mirror on ourselves to say we must take care of our most important asset, which is our workforce. We can't keep lights on, patients in beds, and communities getting the services that they truly deserve and need to have ample population health outcomes if we're not caring for our staff. And so at the base foundation of all that we do is social and racial equity. You'll see we have 5 strategic pillars that we base all of our quality improvement work streams upon in terms of how we go about improvement that supports our mission, vision, and values. You might be asking, where is workforce well-being on the strategic pyramid? And the answer to that is that it is woven into every single operational strategic priority across this system. So not only are we practicing what we preach, but we are putting our money where our mouth is as a safety net hospital system, as a public system. So we have to say that we must have a return on value that we provide. And the only way we can do that is if we really do provide the support to our workforce. And so as we head into today's presentation, workforce well-being will always be enough and not enough at the exact same time. And so for those that are just getting started to say, how can I support my teams, or how can I support my service or facility or institution or organization or approach, please realize that it just starts with you getting started. And so I want to remind you that change is possible, but workforce well-being is not an ideal state. It is a process. It is a journey. It is not about the outcome all the time. It is about just saying slow but surely, can you put one foot in front of the other to prioritize and say that workforce well-being is as important of any other services that you provide, whether you are a doctor, an EMS worker, a firefighter, a police officer. So we say, don't judge each day by the harvest that you reap, but by the seeds that you plant, and realize that a culture of compassionate caregiving to our caregivers might just start with a smile, might just start with asking someone, how can I help you fall back in love with your job? Sitting back, listening, and really trying to see what resources are made available, and potentially even just marketing or campaigning around them so that staff members really understand what is available to them. So realize that not only do we get to plant seeds each day, but we water the seeds of those around us as well. And so I'm going to use a metaphor to start off today's conversation. And for those of you that have seen the movie Titanic or have read a history book, iceberg right ahead. And the reality is that when we think about what really sank the Titanic, was it the actual iceberg? Was it what was above the water's edge that we saw, that many of us at times see as majestic but also quite scary, and the power and the caution that surrounds it? Or was it what was below the water, the things that we cannot see, the things that we do not talk about, the things that live in the darkness and the murkiness that can actually cause the most casualties? And so we realize that the Titanic sank for a multitude of different reasons. Was it the watch persons that were doing multiple shifts back to back and that were drinking on the job? Was it the engineers of the ship that decided to put aesthetics over safety, to not have ample amount of life vests and or boats? Was it the captain saying full steam ahead? Was it the engineers in the bottom of the ship, or those forepersons that were feeding it the coal to make it go faster than it needed to in terms of the visibility that they knew they didn't have? And so I use this as a metaphor because healthcare and being a first responder is just like that. It's multifactorial. It's all of it. It is all of the stressors, the psychosocial stressors that surround us each and every single day that can sink a system, that can sink a team, and that can also sink an individual. And so as first responders, whether you're a healthcare worker or not, these are the things that we know have been around, that we're talking about on a consistent basis. Before the pandemic, we know that regulatory bodies, and while they are our partners to make sure that we have high quality safe care practices for the communities that we serve, we know that there have been a lot of occupational, environmental stressors that have weighed on our workforce members day in and day out as they respond to the most critical events in people's lives and crises day to day. But it's what we're not talking about. It's what lives below the surface that truly can erode a team, that can truly cause challenges, that can really sacrifice the services and the safety that we provide to others, as well as can sacrifice the sustainment of programs and institutions and public healthcare institutions or municipalities such as first responder networks or organizations. So the more we can start talking about stigmatization, shame, embarrassment, the dynamics of day-to-day, the commutes, the challenges that we have throughout the multiple waves of COVID and monkeypox and insurgents and invasions and wars and Supreme Court rulings, and the list goes on. The more that we can start talking about systemic racism and the murder of Black and brown unarmed folk, the more that we can talk about what's going on in the communities across the nation and internationally that weighs on us each and every single day, the more that we can help our healthcare workers not only survive, but move to a state of thriving. That is how we can truly care for our caregivers. And so we have an opportunity to create framework, to look at models, to really make sure that we are doing this in a safe, ethical manner with integrity. Because if we don't, we're going to continue to see what the World Health Organization has already been calling the disease of the 21st century, where we're seeing exhaustion, true compassion fatigue, inequities continuing to build over time. And on top of that, the U.S. Surgeon General over the last few months stating that burnout is a true challenge to our nation's success, to ensuring that our communities that we provide care to will continue to be able to receive the services that they greatly need and deserve and should have access to. And on top of this, the Occupational Safety and Health Administration also only a few months ago declaring stress a hazard of the workplace. So we all know that there have been unique psychosocial stressors with biomarkers that have impacted us over the last 2.5, 3 years. We saw as first responders the challenges of what was happening as guidelines were changing surrounding COVID-19, the ability to not only protect our bodies, but also our minds, how we were surviving through the emotional strains of what we were seeing, hearing, feeling. But on top of that, as I was mentioning before, what was going on around us environmentally, not only with civil unrest due to racial injustices, but seeing that violence across the nation is up, seeing that there are humanitarian crises, human and person-made, as well as natural disasters happening on a consistent basis, all the while charting the course of saying, what uncertain experience are we now going to face again? So over the last 2 years, we have already seen, on top of the stressors that we just talked about that sank the Titanic, if we were to use that iceberg as a metaphor for first responder environments, we are adding to what was already in place and seeing heightened levels of anxiety, depression, compassion, exhaustion, not just fatigue anymore, but also burnout, feelings of hopelessness, helplessness, stress, as well as guilt. And so the more that we can start to normalize abnormal experiences of the stressors that we've been experiencing over the last few years, the more that we can start talking about this, the better our workforce members will be. And we now live in a day and age where we can no longer split who we are or compartmentalize who we are as person outside of work as who we are professionally in work. And while we all wear a mask of 1,000 faces each day and wear multiple roles as husband, wife, grandparent, aunt, uncle, best friend, first responder, we have to realize that we carry ourselves as one unified individual each and every single day. So the more that we can start talking about total support and care for our workforce members and start to align workforce well-being resources to that holistic individual and to normalize it and say, you can not only use this while at work, but these services can be available to you while also not at work, the better our healthcare workers are going to be. Because what are we seeing nationally right now is that 70% of employees are saying that this is the most stressful time of their lives, and this data is from 2020, 2021, and 2022 on subsequent slides. And we do know that COVID-19 was a significant stressor in a national poll, with 78% of workforce members across the nation saying that this is what's really been weighing on them, on top of the general work stress that they were experiencing before the pandemic had started. We're seeing workers, 83%, suffering from work-related stress on a daily basis. In the days of yesteryear when we'd say, oh, I had a bad Monday or Tuesday, but now having stress Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday, because we can't necessarily escape what's happening outside of work as well, we are now starting to see this truly create sacrifice that we have to start supporting in terms of helping our healers mend. We are also seeing that 77% of employees that took the national poll are now stating that they've experienced burnout at their current job. And this is exceptionally important to see, because what we're seeing is that 40% of employees are saying that their employer hasn't supported their mental health, knowing all of these data points. And that work stress is being reported as the #1 reason why employees are quitting their jobs since the pandemic has begun. 56% blame their employer for failing to encourage just even conversations about burnout, beginning to normalize that. And so as you just heard, we're seeing a majority of workforce members saying that they're experiencing stress now on a day-to-day basis. But 42% of staff are saying that that day-to-day stress is unmanageable. And so what does that do not only to the individual? It echoes out, it spreads, it impacts their families, it impacts the teams that they're working on, and it impacts the communities that we serve. And so on your screen right now, you can see some national poll data. 62% of nurses reporting burnout on their current position right now. Physicians also reporting burnout while on their job. And for those of you that have a child in your life, 67% of those that have a significant relationship with a young adult or adolescent or latency age child are reporting the highest levels of stress since the pandemic has begun. And so what we need to start doing is start destigmatizing mental health among our first responders. The day and age of us being afraid of saying, I'm not okay, has to change. It's okay to not be okay, but it's not okay to not be okay alone. And the more we can say that mental health is a true epidemic here in the United States and now internationally, the more that we can start to normalize the seeking of services. That doesn't say that through the court of public opinion that that first responder can't be a productive, effective workforce member, that they can't practice the top of their credential, their license, that they can't put in a hard day's work and uphold quality and safety of services and care. How come when I, who am a diabetic, could easily pass out because of a blood sugar drop while on work? How come I'm more willing to talk about that than if I am seeking psychotherapeutic services or have a mental health diagnosis that I'm seeking medication management plans for and supportive psychotherapy, like you would for any medical ailment? Seeking a doctor, having an intervention, potentially having medical interventions. And so what we know is that 2 out of 10 adults will have a diagnosable mental illness this year alone. And what we also know is that 2 out of those 10 will not seek services and will go untreated. And why is that? It's because of socialized and individualized stigmatization. It's because a lot of the times our workforce members do not even know what is available to them. 60% of Americans are now reporting suffering from anxiety, depression, or stress. And while that is a scary data point that over 1 out of 2 individuals across this nation are now reporting this at the highest levels of a 5-point Likert scale, what I like about this is that people are now talking about it. We've seen mental health incidents increase 4 times since the pandemic has started. And this is something that I think we can all start realizing, is that almost 1 out of every 2 Americans, 46% of adults within the United States, will experience some type of mental health disorder in their lifetime, within their life cycle. So how come we continue to stigmatize this? What do we need to do to start breaking down the barriers of silence, to stop stigma, to start healing, to reveal it so that we can heal it, so that we can take care of the total workforce member, to realize that mental health is part of overall health and needs to be prioritized just as much as physical health? Because if we don't, we are going to continue to see something that we do not want to see, which is death by suicide. And healthcare professions, unfortunately, have a disproportionate impact in terms of completions of death by suicide. We are losing approximately 1 doctor a day to death by suicide. That is 300 to 400 physicians per year. That is almost 3 to 4 medical schools wiped out each and every single year. It is the top occupation, well, one of them now, because we're starting to see allied professionals, first responders are starting to see the exact same data points. But in terms of healthcare professionals, if you are a female identifying physician, you are over 2 times more likely to not attempt suicide, to complete suicide. And if you are a male physician identifying as it, almost 1.5 times more likely to do that. So when we zoom out and we look at the 2020 data from the CDC, nearly 46,000 people died by suicide in 2020. And if you think about that, that's getting close to how many people die by diabetes. That is 1 death every 11 minutes in the United States. And that is only speaking about the completed suicides that are documented. What we are starting to see in reports is that for every completed suicide, there are over 17 attempts. And what we know is that over the last year, reported and documented 1.2 million had attempted suicide over the last year. And while I'm showing you some grim data points in this moment in time, it's important for us to realize that this does not discriminate. This is not a socioeconomic status, race, religion, sexual orientation, gender identity or expression, discipline-specific challenge. This can happen to anyone. It can happen to you. We are all susceptible. We are not robots. We are humans. And although we've been deemed healthcare heroes and first responder heroes, what that does is it actually makes us feel like we cannot have the feelings that we need to have. We do not have superpowers. We are humans helping humans, and we are just as susceptible to the challenges and the stressors that surround us as any other industry. Unfortunately, as you're seeing, at times at a higher rate. And so what is also encouraging is that 93% of adults surveyed in the United States in 2021 believe that suicide can be prevented. And so while we've talked a little bit about stressors that surround us and death by suicide rates and risk, we also have to realize that most of the time our staff have not been given the time to process and reflect to what their experiences really have been. What we have not done is realized that we are all just big babies. We often say that children and adolescents don't know how to put words to their feeling states. Well, we're on the same continuum in the life cycle. And I don't know about you, but at times I have not taken the time to really ask myself, what am I thinking? What am I feeling? What am I experiencing? How is that impacting my actions and my behaviors? How is that impacting the work that I do day to day, not only at work in my professional realm, but also in the realm of my own home with my loved ones? And so there are words to help our staff start to put to their feelings. And the more that we provide space and time for our staff to actually say how they're feeling, even if they're not feeling okay, the more that we can then say, well, this resource or this service might actually benefit you more. So maybe they're not at risk for death by suicide. Maybe they haven't really identified the root cause of their stressors, but do they understand that there is a chronic condition right now of just languishing, being meh, not being themselves. And I don't know about you, but I've compared myself, which I can no longer do, to my 2019 self. And I'm not feeling the same. And I have to be okay with that. So there has to be a certain level of acceptance and understanding. And the only way that we can do that is we create a culture that allows that kind of conversation. And similarly, do our staff understand and realize that many of them have been experiencing moral injury or moral distress, right? So when mask mandates were out, even before vaccines were out, and I saw people in New York City, the epicenter at that point in time, saying that COVID-19 was not real, that the pandemic's not real, as I was seeing trucks full of bodies, that really started to cause me to question, do I live in a society that I was raised in, that the values that my family taught me about public health is not real? I started to question more than just myself. I started to question the nation, society, and the universe at large. And so we have to realize that stress and burnout is multifactorial, but that the cure for it can't just be about caring for oneself. It has to be all of us caring for each other, because if we don't, we are going to see another epidemic continue to burgeon, which is the great resignation across first responders. And speaking solely about healthcare workers in this moment, 1 out of 5 healthcare workers has already left their jobs since the pandemic started. And we are seeing that this just continues over time. And so what can we do to stop the bleeding? Is that we can talk about moral injury, we can talk about death by suicide, we can talk about stressors, compassion fatigue, burnout, anxiety, and depression, and ensure that we have resources that are aligned to support the variety of different needs, which is not always to the extreme extent either, which I'll talk about a little bit later. But what we need to start doing is focusing back on the value. Because what we've learned is that healthcare workers, on top of the international global pandemic, on top of the epidemic of systemic racism, on top of the epidemic, the public emergency of gun violence, on top of the now epidemic of mental health crises with access challenges, we have a value crisis in the United States in terms of healthcare workers. And I'm sure that this might be true for other first responders. Right now in this nation, there's a report about to be published that 1 out of every 2 healthcare workers in this nation does not feel valued by their organization. And what does that do? What we've learned is that the more you feel valued, the more that the stressors and the experiences that you face day to day, you'll be able to survive. You'll be able to thrive through, because you actually believe that what you're doing is making a difference. And as we've learned from Press Gaining, who is our vendor that supports us with not only our patient satisfaction surveying, but our employee surveying, for feedback and satisfaction across the system is that the more our staff like the work that they do, the more that they feel as though they're doing something that's making a real difference and that it's meaningful, the more that they actually take pride in the work that they do, the more that they see diversity of staff as well as communities that they serve, the more that they will not only be able to stay and be willing to stay in the organization if offered another job or offered or over the next 3 years, the more that they will actually be able to build the resilience that's necessary to deal with the stressors that they're experiencing. So what we have to do, and on your screen right now, is internal data to NYC Health and Hospitals. So 90% of our employees believe their work is meaningful, and we are consistently leaning into that. That 67% of our employees feel valued by the organization. So we have to do a little bit better for the almost 30% that do not feel valued, because we need to help them realize that that is part of resilience building. And the thing about value making is that it costs $0. That it takes 30 seconds, and it just takes breath to actually acknowledge and recognize, celebrate individuals that surround us, and to truly thank them for the job that they're doing, and to understand that if they're having a tough day or not feeling okay, or it can't practice to the top of who we know they are to be, that we ask them what's really going on and we provide services rather than deeming them a problem employee. And so as we continue to take a look at other environmental factors that are impacting how we are able to respond to crises and critical events, we are also seeing that because of the pandemic and prior, that employees are citing that they don't have the skills necessary, that they are not able to actually uphold the roles that they're doing. We're seeing that employees are citing a lack of development. These are different ways that we can actually value staff members, is focusing on diversity, equity, inclusion, recognition, to really ensure that we stop the hemorrhaging of that. And so as I continue to show you some data before we go into just some of NYC Health and Hospitals' approach to workforce well-being, there is light at the end of the tunnel. Where there's a shadow, there must be a light to capture it. And so what we've learned throughout the pandemic is that 19% of employees are more likely to feel depressed when feeling supported by their employer. And what we often feel is though we have to create these large-scale well-being initiatives and we have to have tons of programming. But what we've actually learned is that just speaking about well-being programming, that saying that they matter and that this well-being programming is for them and that it's encouraged to use, that almost 20% of workforce members will actually begin to feel different just in their day. And that doesn't even necessarily mean that they'll use it. 70% of staff can feel a stress reduction just knowing that respite services exist. I have a story, and we'll talk a little bit about peer support models and debriefing, and there's also incredible workshops at this conference that I encourage you to attend that focus on peer support models. But I went to do an emotional and psychological peer support debrief, which is a non-clinical intervention that any staff member can do to bring humanity, humility back into healthcare, for us to have a true conversation with active listening and empathy and compassion that then turns into an opportunity to provide concrete resources. I went up to an individual that unfortunately was surrounding a pretty poor patient outcome. And the person said, I can't engage with these services. 3 days later, I get an email. They say, thank you. Just knowing that you showed up and offered them was all I needed to begin to feel better. So again, just knowing that these services are there is the beginning. 65% of employees say that a more supportive workplace culture helps not only attract employees, but helps retain them. And so the last data point on the right side of the screen is both positive, but also our call to action. 96% of employers across the nation report that they have an employee assistance or wellness program. But what you need to also realize is 46% of those same employees polled, nearly almost half, are saying that they are unaware of those services. So what good are services if we aren't posting QR codes for them, putting them in lounges, putting them on cork boards, reminding people in huddles, in safety team meetings, in department meetings, day to day, attaching information to the signature of your email line. So please realize that we have to start getting the word out. And you don't have to, again, reinvent the wheel. Sometimes it's about taking what's already available to you nationally, statewide, citywide, or even in your own town to start promoting that in addition to what you think you can begin to foster or nurture within your own teams or within your own facility service lines or organizations. Because the healthier our workforce members are, the more that they feel seen, heard, respected, celebrated, the more that they are given time to speak about who they are as individuals, what they are experiencing and how that is impacting them, the more engaged they will be. And the more engaged you can help them be by providing opportunities to connect to resources, if requested and if recommended. And we have learned that the more engaged a frontline workforce member is, that we are 3 times more likely to have an early catch or a near miss, or to ensure that quality, safe care was provided in that critical moment. And what does that translate to in healthcare, but to all industries, is better satisfaction and support for the communities that we serve. And this is that cycle that we were talking about before. This is what helps staff feel that there's meaning and purpose and that they're making a difference in their life. So we have to realize that there is a true business case to workforce well-being. And something that was recently promoted by the Schwartz Center for Compassionate Healthcare is that there are many implications to this. $40,000 to $50,000 to replace a registered nurse, up to $1 million to replace a physician, 71% higher likelihood of medical errors among nurses with poor mental health, 78% with physicians due to burnout. And so we have to really see that if we don't take care of our workforce members, this is going to impact how we provide frontline first response support to whatever communities that we serve, and that there is a financial cost to this as well. 93.5 billion estimated costs associated with suicide and attempts. These are lifetime medical fees and lost costs due to not being in work. $1 trillion annual depression and anxiety costing the global economy and productivity. And how many people we can support at one given time. 16 trillion global economics of mental illness projected to grow by 2030. And the one that I really want to call attention to is on the right side of the screen, $1 trillion in annual national costs in the United States alone based on preventable medical errors and patient deaths. And so the 4th leading cause in the United States right now is accidents, and falling within that is preventable medical errors. So what do we do? Well, I'm going to show you what we did as NYC Health and Hospitals. And if NYC Health and Hospitals, the largest municipal public healthcare delivery system in this nation, can do this, so can you. We started small, but we started with support and buy-in and a true mighty effort that was organized, that was collaborative, that was top down to get it out there, but then built ground up with the voices of those that we wanted to support. So if we can do it, so can you. And so I want to remind you that New York City and Elmhurst Hospital, which is part of NYC Health and Hospitals enterprise, was the epicenter of the epicenter at the beginning of the pandemic, when we didn't even understand what the experiences were. On March 13th, first COVID-19 positive patient confirmed, and by March 25th, the crisis intensified, where 13 patients passed away within a 24-hour period. Think about this. And although medical providers know that unfortunately death is part of the life cycle and that people do succumb to illnesses and injuries despite how much effort we put in, but just think about the weight and strain on our workforce members. And so NYC Health and Hospitals came together. We said this has to be a true unified and uniform approach to how we can support our workforce members. And so we created organizational structures aligned to emergency management structures so that we could really focus on the various phases of preparedness and response and mitigation, but not doing it alone, doing it together as a system with strategic goals, objectives, priorities, aligning roles and responsibilities so that each and every single person, whether they had a true HR title that deemed them an authority or a leader, to really provide a culture of situational leadership to say we can all get involved in this, and that workforce wellness is not my, as System Chief Wellness Officer's role alone, that it takes a village, and that it has to be rolled into day-to-day operations, and that it is seen as part of daily work as a manager and as a first responder frontline worker. This is all of our duties. And so what we did is we created steering teams at each facility across all service lines, and you can mirror this in just a small department. Make sure that you have interdisciplinary and interdepartmental voices to start talking about what does wellness need to look like for our team, for our division, for our department, for our service. And how can we go about this and divide and conquer so it doesn't fall on the shoulders of one individual? And how can we build the capacity for well-being, just starting with we're committing to the culture. And on your screen right now, this is the 14-step, 100,000-foot view of how we built Helping Healers Heal, our workforce well-being program at NYC Health and Hospitals. And although we started back in 2018 prior to the pandemic, these are steps that anyone can replicate at any size organization, even just on a small unit or team. To realize that you can build that coalition of voices, identify risk areas and where we need to start doing targeted implementation or targeted support for staff, to inventory our resources, to package it and sell it, to understand what our gaps are, to bring that steering team together or those voices to say, how can we close this together, to build the communication and strategy plan so that we can not only reach out to ask people to get involved, to learn about well-being, but also how to facilitate well-being. And part of what we started with at NYC Health and Hospitals was a framework that already existed. So on your screen right now is Dr. Susan Scott's 4U team. It was the first ever second victim response team model. We adapted this model and modified it for NYC Health and Hospitals, which was build up what we call Tier 1. Make sure everyone across every team and discipline and tour knows what the definition of wellness is or what the wellness program can be and where to get it. And the more that you build that groundswell, the more people will be willing to actually enhance their engagement with wellness. And so we at NYC Health and Hospitals adopted a peer support model where we train our staff, does not matter their education background, level within the organization, their title, their discipline, whatnot. We can train them with empathy, skill building techniques on how to provide a non-clinical intervention, which I mentioned before is an emotional, psychological, what we call peer support encounter. You can start to train people, have one on every team, responsible to just know how to have a conversation, open up dialogue, because that's where it begins. The more we can identify it, the more we can begin to close those gaps to support that workforce member in the time of need. Think about how we triage as first responders. Think about the first aid, psychological first aid that we provide to others. Think about how that could look for your own team, but done in a non-clinical fashion with a referral network, which as you see is the Tier 3. What supports resources and services around you can you say we can always use this to connect the individual to if they're interested and promote that as part of the services. So in the peak of the pandemic, as a safety net hospital system with very little dollars, what we did is we combined our efforts. We created education on an ongoing basis, 30-minute webinars for public consumption, if you will, layman's terms of what does it look like to be in crisis, how do you know when you're experiencing stress, and what can you do about it? We created, and I heard the last fantastic workshop talking about a counseling or support hotline. Do you have a hotline for your staff? And if you don't have it internal to an organization, there are plenty across the cities and states that we can easily connect with. Can you create an environment, whether it's a pre-established lounge, a cafeteria, just an area where you can say, this is where you can relax, find respite, create a wellness space. You could even just do what's called a wellness event, saying in this area at this time, we're focusing solely on well-being. And can you bring in external partners if you don't feel comfortable doing it for yourself to say the staff is worth it, let's bring in these resources. So also, if staff can't go somewhere to feel well, bring the wellness to them. What we've done across NYC Health and Hospitals, proactive unit and departmental-based wellness rounds, going to an area where the team is with a compassion cart, with bottles of water, with resource pamphlets and handouts, and starting those debriefs that I mentioned before. And use expertise around you. At NYC Health and Hospitals, we have licensed creative arts therapists, people that are trained in the intervention, if you will, and utilization of the healing powers of art mediums, music, movement, art, drama, poetry, right? All the different modalities to be able to do an event for staff. So look for the internal resources that you can use to build morale, such as visual and auditory management solutions. What can you do to help them feel well while at work? And the truth is that not everyone needs therapy, but that everyone does deserve support. And what we realize is that 75 out of 100 employees only requires just a little bit of nurture, just a little nudge to say, how are you? How are we doing? And not just to say, how are you? And let them say good, but to actually ask an open-ended question and to really understand their experience. The more that we can just do these nudges, have a peer support encounter. The more you can begin to build and scaffold a sustained support of well-being within your workforce, which only again translates to us providing better frontline support to the communities that we serve. What we also know is that 24 out of 100 employees just need a little additional support. And so again, that's what that peer support model is for. That is what some of the resources that are made available around you or as part of your employee benefits package or EAP, just promoting those services is enough. And what we do know is 1 out of every employee might require an alternate level of support that might require acute need. And so please make sure that you have a crisis response algorithm or workflow in place. Do you know what happens if you start to see an employee acting erratic, or you see their light dim to the point where you're now starting to question their safety? Make sure that you have people agreeing upon how you would surround that individual, that workforce member, in a person-centered manner with cultural competence and sensitivity around what they might be experiencing, and make sure that you have the connection to care that they might require. And so I want to show you that we did truly start small. Back in July 2018, when we started, those were 3 debriefs, and we consider an encounter a one-on-one with an individual, a group debrief, which can be an interdisciplinary team or one whole department, and those wellness events, sometimes nonverbal processes that we provide as active experiential for staff to process and reflect and express. So as it started to build, you can see the groundswell was there as staff started to hear that this space is truly confidential, is truly private, is not going to show up in your performance evaluation, that it actually did feel supportive, and that what it did is it broke down those silos. It broke down the stigmatization. It broke down the sterilization of the environments and the stoicism that we've been taught to just say you're okay even when you're not, because you're afraid that maybe you'll not be able to be board certified or licensed or be able to come back into work. The more they realized that those spaces made them feel validated and seen and valued, and that they weren't alone in their experiences, that is when the program grew on its own. And so this data ends in May, and I'm really happy to report that in just 2022 alone, we have touched over 44,000 employees, and those are not unique encounters. So those are some using multiple encounters over and over again, multiple wellness events, multiple programs. We've had almost 3,600 debriefs, let alone in 2022. So looking from January 2021 to August 2022, you can see we've had almost 5,000 debriefs at that given moment in time. Same thing with wellness rounds. We're seeing our wellness rounds go down, but we're seeing our debriefs go up. But the point is we're getting out there. And when we're getting out there, we're also crowdsourcing information and utilizing a platform that we built with our vendor, Pressgany, to be able to, in real time, document private and confidential information, not identifying the individual, but being able to help us understand how burnt out is the staff, how aware of resources are, right? So the idea is something that you need to do is to measure, to understand, to survey, to understand what the current state of your well-being is within your workforce, and do they know about resources? Are they willing to use it? If they used it, how satisfied were they? And to really start to get their feedback and to get you out there visible, saying we can all be compassionate caregivers and champions and advocates of workforce well-being. It is about building and joining the movement. And so you can see our wellness areas have all obviously gone down since the first few peaks of the pandemic. But what we've actually started to do is start to enhance those spaces and ask the staff, why has the visits gone down? And as I mentioned before, if you measure it, then you know what is happening so that it can help you drive, so that there's a roadmap, if you will, to see what is the biggest bang for your buck. What can you actually stratify to say what will take the least amount of effort, but have the biggest gain and win with our staff members. So we have dashboards. We have scorecards that are talked about in these system-wide steering team meeting calls and talked about at an individual facility level so we can encourage departments to get along. You can measure even in your own team. And something that we want to talk about is measurement is not always quantifiable or needs to be. What about the qualitative data? What about their actual voices being heard? The more that they feel that they not only share their voice, but that it was listened to, the more of the culture of compassion and empathy and psychological safety you will build. And so what we do is we survey our staff every so often to say, what programs do you want? What programs are working well for you? And guess what? You don't always have to have the answers. They'll tell you. And you can ask yourself, what can I truly scale within reason? And it's something is better than nothing. And so I'll give an example. The staff really appreciated us providing them meals, and through incredible philanthropic donations, we were able to feed every single workforce member a hot meal once per shift throughout the first wave of the pandemic, as well as through Delta. And the second round was based off of what we learned from those staff feedback surveys. And so our milestones, this is not me patting NYC Health and Hospitals on the back. This is us saying that we had nothing prior to 2018, and now look where it is. So I want this to inspire and motivate. I want you to realize that even though the Joint Commission published us as a best practice in the source, which is their journal, even though we've won 2 International Workplace Wellness Awards in 2021, we still have a long ways to go in terms of staff being aware of the resources. So on the left side of your screen, 56% of the staff are now more aware of or have actually utilized services. And we still got work to do. So as I mentioned before, if almost half of our staff are either not aware or not using services, then those awards and those best practice journals mean nothing to me. It's about people knowing the services and feeling comfortable and psychologically safe enough to utilize them. So on your screen right now, we are every 2 years doing a system-wide employee feedback survey with resilience, well-being, and crisis response modules, as well as safety modules in terms of the safety we're providing, diversity, as well as staff engagement and satisfaction. And so we're using this information to say, how can we get unit or departmental level information to not use punitively, to not say, well, what's wrong in that area, to say, what can I do to surround you with support? How can I help you? And change and transformation is part of well-being. Wellness has to be flexible with the time. So as I mentioned, we started off at NYC Health and Hospitals as a second victim response initiative. We, in 2019, became more inclusive of compassion fatigue, vicarious traumatization for our behavioral health workforce members, as well as burnout. And then as soon as the pandemic hit, we focused more on crisis response, traumatization, grief, and have now landed, in addition to that, just focusing on the general term of stress. But what's most important is that at NYC Health and Hospitals, we had to ask ourselves, what is wellness and how does that change over time? So if your team doesn't have a definition, if your facility doesn't have a definition, if your department doesn't have a definition of it, then realize you can actually look around you and align to dimensions of well-being, or just scour or comb through Google to see what's really out there. So on the right side of your screen, with an interdisciplinary team, we created NYC Health and Hospitals definition of wellness. This is our guide. This is our vision. This is what we are aiming to do, is to help our staff be conscious about their own well-being, to make sure that they can reach out for support services that align to whatever well-being they need, whether it's for a debrief, whether it's to learn about how to access a virtual gym, whether it's to speak to chaplaincy services for spiritual support. We have aligned to the 8 dimensions of well-being. And what we did is, with this framework, which is out there for use for everyone, we started to say, well, how do we define it for ourselves and make it simple? How do we get these definitions out there so the staff even understand what the dimensions of well-being are? And how do we start to align all of our programming to ensure that they have access to that? And so what you can do is just change the narrative, change the dialogue, change the tenor of how we provide true support to our teams. And sometimes it just takes 5 or 10 minutes at the tail end of a meeting to say, how can we all motivate each other to remain engaged during this very challenging time because morale has been low? What have you been doing to care for yourself? What is your sleeping and eating habits? To go round robin or to popcorn it out? So realize that all it takes is you looking at one of these tiles each day for your work day and just opening up a conversation about it. That's all it begins to take. And so throughout the rest of this presentation over the next 10 minutes, and hopefully I'll leave a few minutes for questions, and if not, my contact information is here. I'm just going to show you what we've been able to do as a public safety net system. So in terms of emotional well-being, we've made it our priority and aligned to the annual World Health mental health observances that we needed to focus on refreshing, renewing, and reconnecting. We've done a huge anti-stigma campaign, socialized stigma and individualized stigma, to start helping our staff realize that it's okay to utilize services. We have really focused on recognition programs and social benefit programs to build psychological safety so that we can foster connections. And we've provided that ample opportunity to learn while on shift or out. But the thing that we really needed to start to do is to help our staff realize that we need to change how we think. So on your screen now, these are the things that we worry about. And we have over 60,000 thoughts in a day. And what we've learned is that up to 80% of them are not actually true, because even just a smaller scale of what can happen versus what actually happens is how we need to start helping staff approach their day at work and at home by talking more directly about stress continuum, realizing that stress, distress, and disorder look different, and we do not stigmatize disorder because it's dysfunction that can live in either three of these buckets, and that we can start talking about what does healthy stress look like versus not good stress look like, because stress, just like excitement, if you have too much of it, it's bad for you. If you have too little, it's also bad for you. And so what we learned from the U.S. Department of Defense as they were supporting us at NYC Health and Hospitals is that we can use the stress continuum model. We use this on our floors with our staff. I use this with my own team at least once a week. I ask them, what's your color today or this week? And it's not a perfect science. It's about dialogue, which is what I'm trying to say, a compassionate culture for caregivers to really support the flourishing of our frontline. It just starts with a conversation. So with my team member says, I'm orange today, I'm gonna look at what are the features of that, and I'm gonna say, what are our support options? And maybe you need to go home today, and we need to re-strategize how a team member can fill in that day. We know that there's shortages everywhere, but I know that if I send a staff member home and they actually have a good meal, get some good rest, they might come in tomorrow rather than calling out sick the next 2 or 3 days or quitting altogether. And what we've also learned in terms of the emotional domain is that a lot of people don't feel comfortable asking for help or even know how to ask for help. So really looking out there. So the National Institute of Mental Health published this throughout the pandemic. So what we really focus on is if you've had severe symptoms, and you have to define that for yourself, and it's happened for over 2 weeks, maybe we need to start thinking about other resources that we can provide to you. And part of emotional well-being for us was also making sure that all of the information and resources was found in one click. All of your information is in one website area, either on our COVID-19 Resource Hub or our Helping Healers Heal webpage, all has the exact same information. And realizing that what we could also do is start to tailor some of our resources to specific populations. So when we look at our residents and fellow population, our medical trainees, they're at the highest risk for burnout and death by suicide. And so how can we make sure that we target specific resources solely for them and build awareness for those specific populations? We do know that certain areas within healthcare have higher rates of burnout right now based upon the acuity and the needs of the patient demands, the size of services, and to use information to guide your services, but to also use information as a pathway. And the only way that you can create a pathway of information is getting it out there and making it more accessible and quicker to access. And so QR codes is what we've done throughout NYC Health and Hospitals and what we encourage people to do. We also have the hotline that I was mentioning before, but we promote the city and statewide and national hotlines in addition to built our own. Our facilities have them at their own time, but also our system continues to have it. Promoting your already in place EAP was something that we had to do. This is an underutilized service for a lot of systems across the nation. So make sure that your staff know about the EAP and make sure they know the nuances of the program. For NYC Health and Hospitals, the NYC EAP is not only available to our staff, but it's also available to their spouses and dependents. So that was something that was also quite interesting, was helping people understand the misinformation about it, but also just generally informing them about it. Environmental wellness, creating a wellness environment, a wellness room. There are ways for you to capture data. We partnered with the Greater New York Hospital Association, so look for collaboratives. We have data to show that there can be a 69% decrease in stress if staff use the wellness room for between 10 and 20 minutes. We have wellness rooms that have been homemade, where we've just gone to Goodwill and done things of that nature. We've gotten donations from others. We've got the recharge room, but we have actually been in the process of updating wellness rooms. So on your screen right now, these are almost final designs of new wellness spaces popping up that were designed by the staff to say, what space would you want? How would you like to feel? As I showed you, visits were going down in wellness rooms. So I went out using our incredible Helping Healers Heal leads and wellness program directors and care experience officers at our facilities, so know your partners, to cascade to get the feedback. So will staff start to use a room that they feel they were able to help design? You betcha. And in terms of environmental well-being, we have to also remind our staff that most of us have value statements. So how can you make sure that you have value statements, but also maybe nudges, as we call them, little discussion starters or tips to remind people of how to align to integrity, compassion, accountability, respect, or excellence, which is our iCare values model here, but also realizing that diversity is part of well-being. And so does your organization, do you have the ability to start making inclusion groups? They used to be called affinity groups. They're inclusion groups. So if there are marginalized or minority populations across your organization, which we hope there are, right? Can you create community within them to support each other at work and each other, but to also start thinking about how can we begin to look at diversity, equity, inclusion, and humility for the communities that we serve as well. So sometimes it's saying, hey, it's Black History Month. For those that identify or are allies or are anti-racist and want to join in and support understanding about the history, there's coffee out here and let's have a conversation, right? For Pride Month, can you honor that? So there are certain things for International Women's Day, for breast cancer awareness. The list goes on. Find ways to find the communities of experiences and the diversity of people of all social locators and determinants of health to be able to connect and have conversations. Not only does that lead to social wellness, but then you can also have social wellness programming. We created a Battle Buddy support program, which you can easily do. You can assign staff to be each other's battle buddy. You can have them volunteer and sign up to be a battle buddy and either pair them, just by happenstance, or have them pair up with each other. You can send those nudges, those tickler emails, as we call them, discussion starters, to get them to ask each other questions and to be there and to know that anyone that has like experiences or walks a mile in their shoes or can see the world through their eyes because they have also experienced similar things can easily be there. And that adds to that model that I just showed you earlier before, adapting to Dr. Susan Scott's For You team, our Helping Healers Heal program. We added that additional layer of the Battle Buddy because it added as an additional safety net, an additional eye, ear, heart, soul, and support on the line to be able to say, I'm actually worried about this person, and can we escalate that? And can we also take out the sting of what it means to quote unquote escalate to bring in someone to say, I'm worried about you, you deserve to at least have a conversation if you would like it. And that's the thing that we want everyone to know, is that well-being is never mandated, ever. It is never pushed on someone unless it is true critical need or is a crisis in terms of homicidal or suicidal ideation or intent. And so physical well-being, our containers, we have to take care of our containers that house our minds, our hearts, and our spirits. And so do you have access to city or statewide opportunities to create subsidized programming or free programming for physical well-being for your workforce? And for us in New York City, we have NYC WorkWell. But this was also an opportunity for us to start doing pedometer challenges, hydration challenges, to really focus on physiological well-being, to start doing information sessions on healthy eating, on healthy sleeping. And then financial wellness, of course, over the last few years, this has been a very uncertain time. Can you partner with municipalities? Can you partner with banks? Do you have a chief financial officer? Is your human resource director willing to come in to talk about your benefits, to talk about savings, or to bring in people to really talk about finance? So again, you don't always have to do it for yourself. You can bring in others to do it, which brings us to intellectual wellness. Can you get people to do trainings that are of interest to your staff and asking them, what would you like to learn about? Or what do you think you could learn about to help you feel healthier? And so create a platform for that. Sometimes it's just doing it in service during a departmental meeting rather than just talking about the day-to-day operations. And occupational wellness, as we come to a close of this presentation, is all about belonging, growth, flexibility, and purpose. Can you help your staff feel understood? Can you provide that reflection to help them know that they are valued and that they make a difference? Can you provide them the autonomy to be and feel their authentic selves? Can you help them know that they're invested in by sharing those programs so that they can truly feel cared for, which ultimately is what creates well-being. So if you value them, they will value themselves, and then they will reflect that back to others, which creates the culture of purpose and positivity for people serving people, which builds resilience. And last program that I'll speak about before we close up with our learning lessons is if you have connections to chaplains, spiritual care services, synagogues, churches, non-denominational environments, all different religious faiths, realize that moral injury and that moral distress is real, and that it doesn't always have to be about religion or spirituality, but sometimes it's about looking at the greater picture of the world around you. So can you partner with spiritual care services? So the learning lessons, really quickly, there's no time to start like the now. Accept the mess. It's never going to be perfect, so you've got to just get started and realize that you don't have to reinvent the wheel, and that small successes each and every single day build to those very large strides, and that it needs to be rolled into day-to-day operations so one person doesn't feel like it's their responsibility. Build the infrastructure, build the safety, find models that you can use, look for frameworks, but also create those accountable forums, which will help support your strategy. Only measure what you really want to be responsible for, but make sure you're actually measuring something meaningful, and create a roadmap, create direction for yourself. Again, wellness is not an ideal state, and also wellness is not equal to satisfaction. You can be the most satisfied employee and the most unwell employee, vice versa, the most well employee and most unsatisfied or dissatisfied. Realize that recognition programs is what it's all about. And so our key takeaways is start sharing your story. The more you talk about your well-being and the challenges that you've experienced and what worked for you, the more you can create that culture. We don't have to medicalize well-being. It's all about micro-interventions and a variety of holistic programmings. Make sure it's equitable for all staff members, and make sure that we just don't go back to a state of business as usual. So in the appendix to these slides are a lot of different resources that you can read articles on, watch videos of our approach, and I heavily encourage you to look at Module 5 of the Hero New York training. It's free through Greater New York Hospital Association's website. This is all about how NYC Health and Hospitals built our resilience and well-being programming. So I want to say thank you today to all the conference organizers. This has been such a privilege and a pleasure. Unfortunately, I do not have time for questions today, but my email's in the bottom right corner of your screen, jeremy.segall@nychhc.org. I would love to hear from you. And again, my last statement, please take care of yourselves so that you can take care of others. Thank you so much.
Jeremy, thank you so much for that invigorating presentation and all the resources that you have shared with us today, and the ongoing emphasis that you have of you don't have to start from scratch on your own, that the resources are there, and through your presentation today you're providing so many links to those resources, and we've put those in the chat, and then we'll be sharing them out later today when we send out our evaluation for today's programming. We'll share links to the resources, and it feels to me that this goes right in with our theme that Chief Gunderson started with this morning, about talking about that it's, you have the top-down approach, but that bottom-up approach, and really listening to the ideas that your workforce has and can share with you, are so important to incorporate and have that whole included approach to make sure that everyone's listened to. So really appreciate you being here with us today and providing all this information.
Thank you. And again, congratulations on such a phenomenal conference.
Thank you. Thank you. Thanks, everyone, for being with us for this part of the First Responder Mental Health Resilience Conference. We're going to go into a little bit more of an extended break here, so hopefully you can get yourself a snack, some tea or water, or whatever your preference is, and take a little bit of a walk, and join us again at 1 o'clock. And we will be joined by Jen Hart, who will be coming on from out in California to speak more about today's resources. And thank you, everyone. We'll close the meeting again so that we can clear the space and reopen the waiting room. Rejoin with the same link that you joined this session. Thank you, everyone. I'm sorry, I misspoke. We actually have Sam Chase this afternoon, so I misspoke on that. And he will be talking about embodied wellness. I'm getting confused with our lineup, our excellent lineup. So we'll see you then. Thank you.